Here we go. Welcome, everybody, to another episode of The Big Idea. I am your host, Dr. Jeffrey Hanna at Chiropractic here in Spokane. And what we talk about on The Big Idea is how it is that a little problem at the upper part of your neck, where your brain meets the rest of your body, can actually have very big impacts in terms of your health, your well-being, your ability to enjoy your quality of life in ways that many people never realize is actually connected with this part of the body. And what we're going to be talking about today is one that is a bit of a soft spot of mine. This is something as it relates particularly to athletes. And I'm going to be using the example of runners in particular, but reality is this is anybody whose sport involves running, is involved with peak performance, efficiency, balance. So this is whether you are a runner, whether you are short distance, long distance, whether you are a gymnast, whether you are somebody who does athletics. The sky's the limit when it comes to this, and it's the implications about what happens when the upper part of your neck goes out of alignment and how that ultimately can lead to lower body injuries that, despite your best efforts working with the best orthopedists, the best physical therapists, that things are not quite healing and improving the way that you should expect. And I'm going to address one of the possibilities why that might be. So let's go ahead and get into it right away. All right, so picture says 1,000 words. This is one of my favorite pictures, illustrating what the point and the principle of this particular issue actually is. And it's, you see, that when we've got physical injuries in your body, whether or not there are any broken bones or even any bleeding, when there is internal damage to the connective tissues that is normally involved with strengthening and stabilizing your spine, what happens is your brain and body have to try to find ways of compensating for that, especially if you've not gotten the right kind of attention. And in particular, because of the way that we are built, the upper part of our neck is the weak link in the chain. So whether you've had learning to crawl, learning to walk, learning to ride a bike, sports injuries, car accidents, work accidents, all of these things, what they do is they accumulate over a period of time, well, your body has to try to find ways of compensating for this. And no matter how strong you are, your body can only adapt for so long. So the first thing that we would keep in mind here is, have you had physical injuries in the past, even if you thought that everything was just fine? Because in particular, if you've got a little bit of pressure right up through here, what'll happen is it can actually start to create tension on the brainstem itself. And your brainstem is where all of your vital life centers are. Controls your heart, controls your lungs, controls your digestive, controls your reproductive system. It also controls the way that you think. So your brain, if there's ever a problem there, we give the example, if you're poking somebody in the arm, before they punch you, what are they probably going to do? Well, they're going to lean away from it. So if your brain is the one who's making the decision and has to choose between those vital life centers or the rest of your body, guess what it's going to sacrifice first? It's going to sacrifice the rest of your body. Don't make the rules, but that's the way that it is. It's trying to keep you alive. Now here's the kicker then, is that as your body then produces a bit of a shift, as we're illustrating in this particular picture right here, it's going to be, as we showed you, it's like leaning away from the point of pressure, point of irritation. So when it's in the upper part of the neck, where your head goes, your body goes. This is why a bull has a ring in its nose. We oftentimes ask that as a bit of a weird question. It's because the ring is a handle. No matter how small the handler is, and no matter how big the bull is, if you hold it by the nose, it will go where you lead it. Same thing, that's why face masking is such a dangerous penalty in football. So where your head goes, your body goes. Now, in order to keep your body balanced, or more appropriately, your brain balanced, what will happen is we'll start to see changes in a person's posture. I say this all the time. Posture has nothing to do with being lazy. It has everything to do, and it's a reflection of where the points of stress are beneath the surface. It's an outer reflection of your inner reality. Now, As we can see here, what will typically happen is that the head is going to tilt down to one side. One shoulder is going to tip down on one side. It's going to cause tension down the muscles along one side of your body. It can make your spine, your shoulders, and your hips go crooked. And guess what? Because your hips are connected onto your thigh, your leg, and onto your foot, that if you were to, for example, lie down on your bed and have a look at the apparent leg length balance, what happens is you've got this tension on one side of your body. What you'll frequently see is you will see the illusion that one of your legs is actually crooked compared to the other side, when in reality they are probably the same length. Now, as a bit of a side, this is a real interesting point of contention here between chiropractors, physical therapists, podiatrists. The question is how common is the appearance of a short leg, the kind that we're describing right here? Well, there's a bit of a difference. There is what's known as an anatomical short leg. That is where the physical length of your limbs is different. And the other one is the kind that we're describing here, which is a functional short leg. That is, the muscles are tightening in order to compensate for something else. Now, based on the research that we know, the truth is that almost everybody has some degree of anatomical leg length discrepancy. But what we also know is that your body, in its innate wisdom, finds ways of compensating for this. So guess what? If one of the bones in your leg ends up being just a wee little bit longer on one side, well, then this side here is going to be just that little bit shorter. In other words, your body finds ways of maintaining the global balance, even if it means, if you're looking at the individual details, that you would see these variations of anatomy. We can see it where the hips are slightly turned. We can see it where the spine is slightly turning. So sometimes, yes, we're saying that a compensatory scoliotic curve can actually be a compensation, a normal compensation for one of these limb inequalities. And if we go to try to correct that, then we can actually be creating more problems than we're actually solving. I'm digressing a little bit there. One way or another, what it means is because your body looks to find ways to preserve the global symmetry, if we are actually looking at a person's leg length inequality, if we see it, as a general, we can trust that what we are seeing is a genuine reflection of the functional leg length inequality. Because if we see it, unless we're talking about major distortions, beyond like 3/4 of an inch, things like that, your body has usually found ways of compensating for it. So even though there would be two things, it still is going to appear balanced at the surface. So again, when we see an imbalance, we can usually trust that it's because there is some kind of underlying functional condition that's going on. We got to figure out where that's coming from. Now, a lot of times what people say is that they say that when you see one of these leg imbalances, it's because your hips are actually out of alignment and you need either to straighten your glutes, you need to work with a chiropractor who's going to adjust your hips, something like that. But as I've shown you here, and as we said, where your head goes, your body goes. And what we very frequently find then is that the hips are nothing more than a compensation as the body is trying to adapt to a head-neck imbalance. And what it also means, do consider what we're saying right through here. It means that if and when you've got a problem in the upper part that's affecting your brain, your brainstem, your spinal cord, it means that if that pressure is still there, even if you do make a correction for the hips to try to balance the legs out, well, what's going to happen? It's just going to spring right back at you. In other words, where the problem isn't where the problem is. So where the effect is not always where the issue is going to be coming from in the first place. And as we said, the weak link in the chain is where your head meets your neck in what's called the craniocervical or the upper cervical spine. So we can go back to this particular kind of picture here and illustrate again, your body's designed to win. It's going to find intelligent ways to compensate, to adapt for the stresses that are placed upon it. And we've talked about the illusion again, if you're lying down because of that muscle tension. We've also talked about how it shows up in your posture. When you're standing, things appear crooked. And depending then on the kind of physical activities that you do for work, for home, in the course of your life, wherever the points of stress are the areas that are most likely going to break down. So if it's up at the top, one of the first ways it's typically going to show up is the person's going to start to experience headaches. They're going to feel sore in their neck. They're going to feel sore in their shoulders, sore in their back. But it can also lead to uneven shoe wear. Interesting. Why is that? Well, it's because if you're walking around with this tension, this imbalance through your body, it means that the way that you walk is not necessarily symmetrical. And as a consequence, you are wearing down the pattern on your shoes ever so subtly different than you would be on one side versus the other. Now, we're talking about this again in terms of just simply walking and in terms of being able to get by in your day-to-day. But as we said in the beginning, this is going to be a conversation that's geared toward athletes, specifically runners. So I want to show you something that we found in the research that talks about the impact of these leg length equalities and again, the importance of what's going on in your neck. All right, so what we have here, this is a summary article that is in Upper Cervical Subluxation Complex. This is a textbook that talks about the relationship about how problems in the upper part of your neck, again, can affect the balance, the function of your body in ways that people never even realize. And this is it's a bit of an older article, but I think it's nevertheless, it's a fascinating one. This one right through here that was published in the Journal of Manipulative Physiological Therapeutics. Now, what they're looking at is they're looking at the impact that leg length inequality has in terms of in terms of a person's function of what's going on in their body. So one of the things that they talk about early on in the article is generally a couple of accepted premises. Number one is that almost everybody has some significant degree of anatomical leg length inequality. In the same breath, that anatomical leg length inequality is almost always balanced out in one form or another. Therefore, when doing assessments where you're looking for relative leg length imbalances, most likely what you are seeing is the result of muscle tension, as we just described. In other words, the functional variety here. And what that means is it means that rather than giving shoe lifts or orthotics or things like that, you've got to find what the underlying source is, and then the tension will just simply go away and the system comes to balance. Now, what we find is that as a general rule, it's an eighth of an inch, about 3 millimeters. Anything less than that is quite within your body's ability to be able to compensate for that. But it's when we reach an eighth of an inch in terms of the overall tension, that's where there are going to start to be certain kinds of problems. But that's true in the general population. The second that we are looking at, I don't typically think of running as an impact sport. I mean, if you're doing it right, you're going to be using your ankle more as as a spring rather than a shock absorber. So it shouldn't be impactful unless you're going for broke. But nevertheless, there is more force that's going through your body as you are propelling off and forward. Again, this is whether you're doing track and field, whether you're doing other forms of athletics, whether you're doing cross country, whether you're doing stop-start sprints like you would in soccer or in football or in basketball, in volleyball, or if you're doing other things that involve running, jumping, skipping, any of these different things that you're doing up on your feet. The forces that are involved with doing athletics, as a general rule, are 3 times as great as they are if you were just simply walking. Now, what that means, and as the authors talk about, the rule of 3, it's that if a patient or if a person is normally walking around where their head's not on straight like this, and what it does is it creates the tension through the body, and your body has to try to find that way to compensate. The way that it compensates, it's by drawing that leg up by, say, 1/4 of an inch, which is 2 times over the normal value that the body can compensate. That When you're walking, that's pronounced enough. But when you are running 3 times the amount of impact and the force. In other words, you may as well have not a quarter of an inch, but 3/4 of an inch of an imbalance. And I think that you can appreciate that, even if you don't have a degree in engineering or construction, things like that, that a 3/8 inch of a discrepancy 8 times, excuse me, that's not, 6 times greater than what your body should normally be able to adapt to under normal load. That's going to put a huge amount of stress, strain through your joints in one way or another. And guess what? When you do that, and that adds up over a period of months, years, maybe even decades, that's going to lead to problems somewhere in your body. So let's have a little look at that now. So here we are again. We come back to this particular picture. As we said, depending on where your body, quote, holds your stress, based on the kinds of physical activities that you do in the course of your day, sitting, standing, sleeping, sports, all of that kind of stuff there, it can show up in your head, it can show up in your jaw, it can show up in your shoulders, it can show up in your low back, it can show up in your hips, your knees, and your ankles. And particularly then as it relates to athletes, we're talking about lower body injuries, repetitive stress injuries. That can be a plantar fasciitis, that can be knee pain, that can be meniscus. Of course, if you've got an acute injury, that's going to be slightly different here. We're talking about those things that start to accumulate over a period of time that we put down to perhaps overtraining, or that we put down to getting older and the joints are starting to wear out and the muscles are getting fatigued. And then we're also going to be talking about hip damage and low back damage and disc damage and all that sort of stuff. But the possibility here is that it's not any of those kinds of things at all. It's because you are walking, you are running, you are sporting, but you're doing so in an imbalanced state. And it's the accumulation of that stress and that imbalance that is adding up. Now, when that's the case, guess what? You can have all of the therapy, you can have all of the rehab, you can do all of the right things. Change your shoes, change your training, change all of that, work on your muscles. And great, you're doing the right thing, but very likely in the wrong order, because as long as your body is still imbalanced, guess what? Every time that you go out there, you are contributing to that imbalance that is only going to make the issue worse in the long run. So when people actually want to be able to do and to enjoy the kinds of activities that they want to do, yeah, you may not be doing it as hard, as fast, as long as you would have been doing when you were 20, 30, or maybe even 40. But if your body is properly centered, properly balanced, guess what? Things are able to move, things are able to glide, things are able to function in the way that your body is actually designed. And as we also said, is that you can focus on the foot, the knee, the low back, the hip, wherever the problem is, but where the problem is isn't always where the problem is. If the problem is actually coming from up here, that's what's causing your body to destabilize. Unless that area is properly addressed, none of the rest of it is ever going to matter. And as we also said, because the upper part of your neck, it's the weak link in the chain, and it's also the part that's closest to your brain and to all of your vital life functions. If that area is not clear of interference, nothing else that you ever do below is going to work near as well as it otherwise could. And you're unfortunately going to be stuck in a pain management cycle like this. When the truth is, if you can find what the underlying cause, the underlying source of that interference is, what is causing your body to show up and to go crazy in these different kinds of ways, that is where you ultimately have the best opportunity to find a solution here. So I want to give you a few takeaways here, things that you can look at for yourself to see if you might have some of these things that we're talking about here. Again, particularly, I'm gearing it toward runners, but reality, it's anybody. It's where you're noticing that there are a few balance issues. It's noticing where you are experiencing maybe like a plantar fasciitis or foot pain, knee pain, hip pain, maybe piriformis syndrome. It's where there's that lower tight muscle that's always grabbing you down through your hips, down through your low back, that kind of loosens up when you're moving, but then gets worse again the longer that you're actually going and after you start exercising. It's any and all of those things. So, simple exercise, things that you can look at. Number one, go into your bathroom, stand in front of the mirror, relax. So stand whatever feels most normal and neutral for you. And then look in the mirror. And what you're looking to see is there a sign that one shoulder is tipped up or down compared to the other side? If that's the case, you're looking here at your posture. That's a sign that something is not right up at the top and it's destabilizing the balance of the rest of your body. So that's number one. Number two is if you do have spouse, kids, friend, somebody who's able to help you out with this, what you do is you lie face down on your bed. What you do is you bring your knees up so that they're going to be level on the edge of the bed there with your ankles freely over the edge. And then you, as straight as you can, go to lie face down. And then what you have your friend do is have a look at the relative length of your feet, of your ankles. Are they even, or do you see some kind of an imbalance? Because if that imbalance is there where you're lying down, guess what? It's also there when you are standing up. And when you're standing up, of course, that's when you're exercising. That imbalance is going to lead to injury in other places of your body, even if not all at once, but through accumulation. The accumulation of repetitive stress forces. And again, whatever amount of imbalance you see when you're lying face down, multiply that by 3 when you are in that upright, running, sporting kind of position to get a true appreciation of what's going on. Now, it's not always the case, but if you want to do an additional check to see is this possibly coming from your neck, what you do then when you're lying face down in that position is you first turn your head to the right, turn your head to the left, look up at the ceiling, and then look down at the floor. And if your spouse, if your friend, your assistant, whoever it is, sees that that relative imbalance changes in any way, either gets worse or gets better, that is a telltale sign that what is going on and the origin of that imbalance in your body, it's coming not from your foot, not from your hips, but it's coming from somewhere in your neck. And in order to find what that something is, that's where it's going to require a little bit more of an in-depth investigation to find what the true source is. And if you can get and solve that underlying source of interference and dysfunction in your body, guess what? You can restore that balance, and that gives your body that ability to do what it is supposed to do. That is heal. That is take care of you. That is maintain all of your function, your body, your life in existence. And when that happens, not is it just a matter of treating the pain or making that go away. We're looking at peak human potential, your body working the way that it should be so that you can continue to do the things in life that matter the very most to you. And as somebody who does a lot of running himself, there's an old joke. What do runners do? They run. Well, what if it's 60 degrees outside? They run. What if it is 100 degrees outside? They run. What if it's 0 degrees outside? They run. And a very sad thing is a runner who can't run, or a triathlete, or a swimmer, or anybody who's got a passion, even if it is hiking, walking, people who aren't able to do and to enjoy these things, it's not a good headspace to be. So that opportunity to be able to have your body working for you the way that it was designed so that you can actually be well, live well, stay well, enjoy the things in life that matter the very most to you. This then is what upper cervical chiropractic in its core is all about. It's about helping you be able to enjoy the things in life that matter the very most to you. So, hope you have enjoyed that video, find it both informative, valuable, and if we have struck a nerve here, we always ask you 3 things. Number 1, please do like and subscribe to this particular video. That way, YouTube knows that it's important so that other people who are looking for this information can find it as well. Number 2, is if you can think of friends, family members who would benefit from watching this, have a better understanding what's going on in their body, then please do share this with them as well. And number three, if we've talked about something here where you're thinking, I'm experiencing some of these things, but I've never really had anybody look to see if it's possible that my upper neck is actually the source of these things, please reach out to me. You can go to my personal website, which is drjeffreyhanna.com, where we have links to all kinds of articles, videos, blogs, different things like that talk again about the big idea, how it is that a very small issue where your head meets the upper part of your neck can impact your ability to be well, live well, stay well, but also talks then about the bigger things that are involved, how it can show up in ways that people never actually think of. So what you can do is you go again, drjeffreyhanna.com, and you can send me an email. I check everything personally that way, and I'll be happy to have a chat with you, help, and do the very best that you can. And if, of course, you are in the Spokane or the basically Eastern Washington area, and you want to see if we can actually help you out, then go to our practice, which is clearchirospokane.com, or give us a ring at 509-315 8166. Mention that you saw this particular video, that you're reaching out. We will do the very best that we can to help you out. Thanks again for watching this one. Until next time, this is Dr. Hanna at Clear Chiropractic here in Spokane, Washington. Get well, live well, stay well. Till next time, take care. Bye-bye.